everyone. The second part of points of foot Shaoyang Gallbladder Meridian. Gallbladder 20, 风池. This is a very famous point, the intersecting point of the foot Shaoyang Meridian and the Yang Wei Mai. 风 means wind, 池 means pool. This point is located in a pool-like depression at the posterior hairline in the temporal region. This point is effective in treating disorders caused by the wind pathogen, so it was named 风池, wind pool. Location: at the anterior region of the neck, inferior to the occipital bone, in the depression between the regions of sternocleidomastoid and trapezius muscle. Indications: first, tinnitus, deafness, swollen and painful eyes, epistaxis, nasal congestion. Second, headache, dizziness, stroke, depressive and manic psychosis. Third, fever. Fourth, neck pain and rigidity. Manipulation: first, needle obliquely 1/2 to 1.5 cun toward the contralateral or ipsilateral corner of the mouth. Local soreness and distension can spread to the top of the head, temporal region, forehead, and eye. Second, needle transversely 2 to 3 cun to penetrate gallbladder 20 on the other side. Local soreness and distension can spread to the top of the head. Third, needle downward 1 to 1.5 cun toward the nasal tip at the level of the ear lobule. The chief indications for this technique are headache and dizziness. Fourth, needle 0.6 to 1.2 cun toward the contralateral inframedial side of the orbital of the eye. The chief indication for this technique is cervical hyperplasia. Precaution: pay attention to the direction and depth when needling gallbladder 20. If inserted too deeply toward the contralateral outer canthus, the needle can injure the vertebral artery and even enter the cranial cavity to damage the medulla. The vertebral artery and medulla can also be injured if the needle is angled medially and inserted too deeply toward the nasal tip at the level of the ear lobule. As stated in records of Chen Dan-an in acupuncture practice in 1927, a 29-year-old woman who had a very hard life and lived in the same yard with Dr. Chen Dan-an, suffering from a serious headache when she came back from outside. She also had chills and fever. Dr. Chen was a prestigious acupuncture doctor at that time. He came to see the patient, accompanied with his wife. Examination showed a floating pulse and white tongue. He believed that this was due to attacks by wind and cold. Acupuncture was applied on both sides of gallbladder 20, and her headache was relieved immediately. Then, applied acupuncture on bladder 12 Fengmen before moxibustion. Dr. Chen's wife cooked ginger brown sugar soup for the patient because there was no need to take medicine. After about 4 hours, the patient sweated all over the body and was cured. Gallbladder 21, 肩颈, intersecting point of hand and foot Shaoyang, foot Yangming and Yang Wei meridians. 肩 means shoulder, 颈 means whale. The point is located in the depression on the shoulder. As the depression is fairly deep like a whale, the point was named 肩颈, shoulder whale. Location: in the posterior region of the neck at the midpoint of the line connecting the spinous process of the 7th cervical vertebra with the lateral end of acromy. Indications: first, headache, dizziness. Second, difficult labor. Acute mastitis. Postpartum hypercalecture. Third, scrofula. neck pain and rigidity, pain in the shoulder and back, paralysis of upper extremities. Manipulation, needle half to 0.8 cun. Precautions, avoid insert too deep. Do not insert the needle obliquely toward the medial side or deeply when needling perpendicularly to prevent penetrating the lung and causing pneumothorax. Gallbladder 24, 日月. The point is the frontmost point of the gallbladder. The gallbladder is a judge and governs decision-making, which is controlled by the lunar and solar cycles. Thus, the point is called 日月, sun and moon. Location: the anterior thoracic region in the 7th intercostal space, 4 cun lateral to the anterior median line. Location method: the point is inferior to the center of the nipple, 1 rib inferior to lever 14 qi. In females, the point can be found at the intersection of the mid-clavicular line and the 7th intercostal space. Indications: first, vomiting, hiccup, acid regurgitation, jaundice. Second, hypochondriac pain. Manipulation, needle obliquely half to 0.8 cun. Gallbladder 25, 经门. Men means gate. This point, the frontmost point of the kidney, is where kidney meridian-2 gathers. It is the main point for supplementing the kidney and promoting urination to treat water metabolism disorders. Therefore, it is called 经门, capital gate. Location: on the lateral abdomen, inferior to the free extremity of the 12th rib. Location method: with the patient lying on one side, shoulder flexed, locate the free extremity of the 12th rib by palpating below the inferior border of the costal arch, posterior to the posterior axillary line. Indications: first, difficult urination, edema. Second, borborygmus, diarrhea, abdominal distension. Third, lumbar pain, hypochondriac pain, hip pain. Manipulation, needle obliquely half to 1 cun. Precautions: when inserting the needle, avoid penetrating the abdominal cavity and injuring the kidney. This point also combined with backshoe point of kidney, bladder 23 肾腧, to treat kidney problems. Gallbladder 26, 带脉. The point is the intersecting point of the foot Shaoyang Meridian and the 带脉. 带 means belt. 带脉气 passes through the point, which can treat menstrual disorders and leukorrhea, and is called 带脉. Location: on the lateral abdomen, inferior to the free extremity of the 11th rib at the level of the center of the umbilicus. Location method: locate the 10th rib and find the free extremities of the 11th rib, which is situated immediately below the inferior border of the costal arch. Indications: first, regular menstruation, leukorrhea, with red and white discharge, inguinal hernia. Second, pain in the lower abdomen, lumbar and hypochondriac pain. Manipulation, needle obliquely half to 1 cun. Local soreness and distension will be felt and might spread to the lateral side of the waist. Precautions: first, insert the needle in accordance with the thickness of the abdominal wall. Do not insert too deeply. Second, to prevent penetrating the intestinal tract, do not thrust and lift the needle quickly or forcefully. Gallbladder 30, 环跳. Intersecting point of the foot Shaoyang and foot Taiyang meridians. 环 means curve, 跳 means jump. This point is located at the hip joint, with the patient lying on his side and the hip and knees flexed into the shape of the number 4. A curve is formed, as if the patient is in a jumping position, hence the name 环跳 jumping curve. Location in the buttock region at the junction of the lateral 1/3 and the medial 2/3 of the line, connecting the prominence of the greater trochanter with the sacral hiatus. Location method: with the patient lying on one side, with the bottom leg extended and the upper thigh flexed, place the transverse crease of the little finger joint on the great trochanter and point the thumb towards the spine. The point is located at the tip of the thumb. Alternatively, with the patient prone, find the point in the depression posterior to the prominence of the greater trochanter at the junction of the lateral 1/3 and the medial 2/3 of the line, connecting the prominence of the great trochanter and the sacral hiatus. Indications: lumbar and leg pain, atrophy or paralysis of the lower limbs, hemiplegia. Manipulation: first, needle 2 to 3 寸 with the needle tip pointing slightly downward in the treatment of sciatica and disorders of the lower limbs. Local soreness and distension will be felt, and electric-like sensations might radiate to the lower limbs. Second, needle obliquely 2 to 3 寸 toward the genitals and lower abdomen. Local numbness and distension can reach the genitals to treat disorders of the genitals and the lower abdomen. Third, needle perpendicularly 2 to 2.5 寸 toward the hip joint in the treatment of disorders of the hip joint. Precautions: insert deeply may puncture the sciatic nerve. Gallbladder 31. 风势 势 refers to market or gathering. This is an important point that can treat disorders such as paralysis and pruritus that are caused by pathogenic wind, so it is called 风势 wind market. Location: the lateral aspect of the thigh in the depression posterior to the iliotibial band where the tip of the middle finger rests when one stands with the arms extended downward along the thigh. Location method: when the patient stands upright, hands by the sides, the point is at the tip of the middle finger. With the patient lying on one side, the point is on the lateral femoral midline between the ventrolateral muscle and the biceps femoris, 9 寸 superior to the popliteal crease. Indications: first, atrophy or paralysis of lower extremities, hemiplegia, pain in lumbars and lower extremities. Second, pruritus. Manipulation: needle perpendicularly 1.5 to 2.5 寸. So much for the second part of the points.